What is a labiaplasty? Labiaplasty is a reduction of the labia minora, or more commonly referred to as like the inner lips of the labia. The procedure can be done either under local anesthesia, which is just numbing medicine in the skin, or under general anesthesia. It's completely up to the patient. At this point, I'd probably say 50 to 75% of the time I do it under local anesthesia. Patients who have a labiaplasty done under local anesthesia, a lot of them choose to do so really because it provides another layer of privacy. I have had patients who don't really want to share that they're having the procedure, whether it be friends or family, and one of the nice things is they can actually drive themselves to the surgery center where it's performed, and they can drive themselves home. You can eat the day of surgery because you're not getting anesthesia, so that you don't have to fast in any way. When it comes to the location of the procedure though, I always do it in the operating room under just perfectly sterile conditions and for positioning to make the patient most comfortable, as well as to be able to get the things most ergonomic for myself. The labia minora is something that a lot of times really bothers women. It can either be for discomfort, embarrassment, or sometimes even a hygiene issue. Extremely high patient satisfaction rate. I don't know that I've had a single patient who's not just crazy happy with the results from this procedure. During the procedure itself, the labia minora is actually marked for symmetry on what's going to be removed. The excess skin is then removed. Things are then repaired with 2 layers of stitches or sutures to bring things back together. At the time of labiaplasty, there's the option, and something I discuss with patients, is the option for what's called a clitoral hood reduction. There's some patients who kind of have excess tissue that kind of overhangs or covers that area. That's something that we address and talk about during the initial consultation, as well as the preoperative appointment leading up to surgery. It's an option. Again, it's just up to the patient. After surgery, I do provide pain relievers, but really varies. I would say on average, patients take anywhere from 1 or 2 to maybe a handful of pain relievers in the first couple of days after surgery, but again, very well tolerated and extremely high satisfaction rate. Recovery after labiaplasty is really about just taking it easy. I really recommend minimizing even a ton of walking throughout the first week or so. Big picture wise, nothing in the vagina for 6 weeks. And what I mean by that is no intercourse, no tampons, nothing for 6 weeks. We want everything to just heal pristine, and then you have the rest of your life to do what you want to do. So this is a procedure that is not really specific to just, let's pretend, like women after having children or something like that. I've had patients come in as young as in their late teens who, for whatever reason, it's just like anything else, any part of the body that there's just really differences in anatomy. As far as age or anything like that, or having had children or not, it doesn't really have a whole lot of bearing on it. As far as any kind of discomfort, some people have potentially psychological or emotional discomfort. It can be uncomfortable with either intercourse or bike riding or horseback riding or things like that. But overall, again, just a huge relief for patients, and they're extremely happy following.